Hello everyone, my name is Anagha Ramesh and welcome to MSc Counseling Research Conference 2023. Today I'll be presenting on my dissertation topic, The Perfect Counselor, exploring the link between perfectionism and burnout in trainee counselors. Training to be a counselor can be a rigorous process as trainee counselors manage multiple roles and responsibilities of being a student, counselor, researcher, and a supervisee. The constant pressure and aspiration to do exemplary work are similar to all individuals emerging in their professional field. However, this stress can sometimes negatively affect the well-being of the trainee counselors, impacting how they perform in a therapeutic setting. During the COVID-19 pandemic, research has revealed a burnout rate of 37.4% among healthcare personnel, indicating a significant increase in burnout. The increased demand for the services has put additional pressure on trainee counselors who may already be experiencing high levels of stress and pressure due to the demands of the profession. Moreover, many trainee counselors also experience stress related to worry and self-doubt about their clinical performance and expectations for clinical outcomes. Setting high standards and expectations for oneself is related to perfectionism. Perfectionism is often viewed as a unidimensional construct. However, recent researchers have found that it is multidimensional and multifaceted. Two distinct dimensions of perfectionism have been identified, that is, perfectionistic strivings and perfectionistic concerns. Perfectionistic strivings refers to an individual's tendency to set high personal standards and strive for excellence. This dimension of perfectionism is sometimes referred to as adaptive perfectionism because it can lead to positive outcomes like lower levels of stress, and they are also more open to acquiring new skills, leading to better overall psychological well-being. They are also associated with higher levels of psychological flexibility and higher self-esteem. On the other hand, perfectionistic concerns refers to an individual's tendency to set high personal standards and as well as being preoccupied with concerns over making mistakes, the fear of failure, and the negative evaluation from others. This dimension of perfectionism is often referred to as maladaptive perfectionism because it can lead to negative outcomes such as anxiety, depression, low self-esteem, procrastination, impaired social relationships, increased stress levels, and burnout. Coming to burnout, burnout is a state of physical, emotional, and mental exhaustion that results from prolonged periods of stress. It is characterized by feelings of depletion, cynicism, and reduced effectiveness. Burnout has significant impact on individuals, manifesting in psychological issues such as difficulty concentrating, memory problems, depression, anxiety, and low self-esteem. It also leads to physical health problems like cardiovascular disorders and chronic fatigue. Moreover, burnout results in behavioral consequences such as job dissatisfaction, low organizational commitment, increased absenteeism, and decreased performance. Additionally, not only on individual level, organizations are also negatively affected by burnout through reduced service quality, conflicts, and economic losses due to absenteeism and counterproductive behaviors. There are different domains where burnout can be experienced. This includes personal burnout, which is defined as a state of prolonged physical and psychological exhaustion in general life, while work burnout is a similar state that is perceived to be related to an individual's work, and client burnout is perceived as related to individuals' work with clients. Trainee counselors are a particularly important population to study when investigating the relationship between perfectionism and burnout. They face unique challenges in their profession and are still developing their skills and confidence in providing counseling services while also navigating the demands of academic coursework and professionalism. As adaptive perfectionism yields so many positive outcomes, can it serve as a protective factor for trainee counselors? This brings us to the aim of my study, which focuses on the multidimensional aspect of perfectionism, asking the question, is there a difference in the relation between the levels of perfectionism on types of burnout? Based on this, three hypotheses were formed. Hypothesis 1A states that trainee counselors with adaptive perfectionism will report lower levels of personal burnout compared to trainee counselors with maladaptive perfectionism. Next, hypothesis 1B states that trainee counselors with adaptive perfectionism will report lower levels of work burnout compared to trainee counselors with maladaptive perfectionism. Last, hypothesis 1C states that trainee counselors with adaptive perfectionism will report lower levels of client burnout compared to trainee counselors with maladaptive perfectionism. For this study, a between-subject research design was used where perfectionism was the independent variable and burnout was considered as the dependent variable. Perfectionism was measured using the scale Short Almost Perfect scale, which has subscales, standards, and discrepancy. Based on the scores of these subscales, the participants were grouped as maladaptive perfectionists or adaptive perfectionists. Participants with high scores on standard subscales and low scores on discrepancy subscale were grouped as adaptive perfectionists, while those with high scores on standards and high scores on discrepancies were grouped as maladaptive perfectionists. Next, burnout was measured using Copenhagen Burnout Inventory, which has three subscales that evaluates burnout in three domains, that is personal life, work-related life, and client-related work. Initially, there were 50 responses, but after cleaning the data, the final sample size included 22 participants. The participants were recruited through opportunity sampling via training organizations, social media platforms, and word of mouth. The inclusion criteria for the trainees were that they had to be presently enrolled in a practitioner-level counseling training program that has an integrated assessed placement. Also, they should have completed at least one session with their initial client. There was no exclusion criteria based on age, gender, or ethnicity. The research was conducted maintaining all the ethical responsibilities. Coming to the results, the data was analyzed using SPSS. When looking at the demographics, majority of the participants were female of 16 in number, 5 male participants, and 1 non-binary participant. Also, majority of the participants were of white ethnic background, where 15 identified as white, 5 identified as Asian or Asian British, and 1 each identified as other and Middle Eastern. Out of the total sample size, 8 participants were grouped as adaptive perfectionists, and 10 participants were grouped as maladaptive perfectionists. The data was normally distributed, and an independent sample t-test was done to test all the three hypotheses. As you can see from the graph, a significant difference is shown between adaptive and maladaptive perfectionists for personal burnout. However, there is no significant difference seen for work and client burnout. Based on this, we can say that hypothesis 1A is accepted, while hypothesis 1B is rejected, and hypothesis 1C is also rejected. Next, as we discuss the results of the study, for hypothesis 1A, it was seen that trainees with adaptive perfectionism did report lower levels of personal burnout compared to trainees with maladaptive perfectionism. This is because adaptive perfectionists are able to recognize and modify their expectations and are linked to greater resilience. Also, according to two models, that is conservation of resources model and jobs demand resources model, views that burnout can be prevented using one's professional and personal resources. These personal resources are self-efficacy, resilience, which serve as additional barriers against burnout, which are linked to adaptive perfectionism. Also, according to Hamachek's theory, individuals who enjoy the demands of stress more and do not feel the need to work as diligently to meet them relates to adaptive type of perfectionism, which is considered more normal. Also, coming to maladaptive perfectionism, research suggests that people who work in helping professions frequently extend these responsibilities to their personal lives as well. This makes it harder for them to ask help as they fear to be perceived as failure, which aligns with the tendencies of maladaptive perfectionists. Next, as we discuss the results of Hypothesis 1b, it is seen that trainees with adaptive perfectionism did not report lower levels of work burnout compared to trainees with maladaptive perfectionism. The possible reason could be that other confounding variables like organization culture, which impacts trainee counselors. The potential factors that contribute to trainee counselors' workload are the duties of the organization and navigating the office climate, which may include their interactions with co-workers, managers, supervisors, and professors. These key employment resources can serve as a buffer against the demands of person's employment and have a direct impact on the person's motivation and engagement at work. The organization environment, if not conducive, can heavily influence burnout. Also, as trainee counselors who experience role overload can experience role conflict due to high conflicting expectations and can experience a sense of helplessness, making them more vulnerable for burnout. There can also be expectations to do supplementary work like administrative work, which can lead to stress. Additionally, we can also understand this result via self-discrepancy theory, which suggests that people compare themselves to their own internal standards, which is the ideal self, like they have to do exemplary work with their client in the organization, etc. And then there is odd self that is formed through the expectations of others, like expectations of the organization in regards to different roles trainees take over. If the individual is not able to close the gap between these selves, that is the ideal self and the odd self, it can lead to stress contributing to burnout. Lastly, as we discuss the results of Hypothesis 1c, it is seen that trainees with adaptive perfectionism did not report lower levels of client burnout compared to trainees with maladaptive perfectionism. To understand this result, it is important to consider personal histories of the individual. Professionals with difficult or adverse childhood experiences may have an increased capacity for empathy with clients and can sometimes lead to over-involvement with the clients. This increases the expectations from the trainee counselors and adds to their stress. This understanding runs counter to the burnout model proposed by Maslach, which places all the blame for burnout on the workplace and ignore the importance of personal histories. Trainees may use coping methods established earlier in life to cope with client-related stress, which may not be effective. If unaddressed during personal development, these may resurface when working with the client. This could be one of the reasons why there was no report of lower burnout. Finally, as we come to the end of the study, it is important to acknowledge the limitations of the study, which is the small sample size. This was due to time constraints of the research study. However, even with this limited sample, the study yielded significant insights into relationship between burnout and perfectionism. The participants of the study were predominantly composed of female and of white ethnic background. Future research should aim to include a more diverse sample to provide even more insights into this phenomena. Next, as we discuss the implications of the study, it is important to know that counseling training programs can benefit a lot from the results of the study. That is, they can provide workshops to help trainees understand and manage their expectations for the training program and for their future career. A lay language guidebook can be developed to help trainees better understand the complex concepts and realities of the profession. Also, reducing unrealistic expectations and unrealistic achievement benchmarks can help trainees avoid feelings of inadequacy and help them focus on their progress and personal growth. Fostering adaptive perfectionism among trainees can lead to better work-life balance. Developing metacognitive approaches such as effective goal setting, study planning, and time management can help trainees cultivate adaptive perfectionistic tendencies. Encouraging trainees to set realistic goals and expectations for themselves can help them avoid maladaptive perfectionism and achieve personal growth. Developing a growth mindset can help trainees view mistakes and challenges as opportunities for learning and improvement. Also, developing self-compassion and self-care practices can help trainees manage the emotional demands of the counseling professional and avoid burnout. To enhance current findings, future researchers can use additional perfectionism scales as it can provide a more comprehensive and nuanced understanding of perfectionism. Also, conducting face-to-face interviews can provide a richer and more in-depth understanding of the participants' experiences and attitude towards perfectionism and related constructs. Also, including non-perfectionists in the sample can help identify potential differences or similarities between perfectionists and non-perfectionists. In conclusion, the important thing to take away from the study is that the findings suggest that the type of perfectionism displayed by the trainee counselor is a significant predictor of personal burnout. Specifically, the results indicate that adaptive perfectionism serves as a protective factor against personal burnout, whereas maladaptive perfectionism may increase the risk of experiencing personal burnout. Although no significant differences were found between adaptive and maladaptive groups in relation to work and client burnout, the association between perfectionism and burnout should not be ignored. It is important that trainee counselors and mental health professionals to be aware of potential risk associated with maladaptive perfectionism and to develop strategies to address and manage burnout. By promoting adaptive perfectionism, trainee counselors can cultivate healthier attitudes and behaviors that can act as a protective factor against personal burnout. This is the reference list which you can have a look at. Thank you for joining me today for my presentation. If you have any questions or would like to discuss further, please feel free to post your queries in the comment section below. Alternatively, you can also reach out to me via email at the email address given to you on the slide. Once again, I thank you for your interest in this research and I look forward to any questions or feedback you may have.